altered levels of circulating insulin-like growth factor I, IGF-I, following ischemic stroke are associated with outcome, a prospective observational study. Via latest results for BMC Neurology. Abstract. Background. Insulin-like growth factor I, IGF-I, has neuroprotective effects in experimental ischemic stroke, is. However, in patients who have suffered as, various associations between the levels of serum IGF-I, s-IGF-I, and clinical outcome have been reported, probably reflecting differences in sampling time points and follow-up periods. Since changes in the levels of post-stroke s-IGF-I have not been extensively explored, we investigated whether decreases in the levels of s-IGF-I between the acute time point, median, 4 days, and 3 months, ΔIGF-I, further transformed into ΔIGF-I-quintiles, ΔIGF-I-q, are associated with its severity and outcome. Methods. In the Sahlgrenska Academy study on ischemic stroke, SALSIS, conducted in Gothenburg, Sweden, patients with IS who had s-IGF-I measurements available were included, N equals 354, 65% males, mean age, 55 years. Baseline stroke severity was evaluated using the National Institutes of Health Stroke Scale, NIS, and converted into NIS-quintiles, NIS-q. Outcomes were assessed using the modified Rankin scale, MISES, at 3 months and 2 years. Results. In general, the levels of s-IGF-I decreased, positive ΔIGF-I, except for those patients with the most severe NIS-q. After correction for sex and age, the third ΔIGF-I-q showed the strongest association to MISES 0 to 2, odds ratio, or 5.11, 95% confidence interval, 2.18 to 11.9, and after 2 years, the fifth ΔIGF-I-q, OR 3.63, 95% SI 1.40 to 9.38, showed the strongest association to MISES 0 to 2. The associations remained significant after multivariate correction for diabetes, smoking, hypertension, and hyperlipidemia after 3 months, but were not significant, p equals 0.057, after 2 years. The 3-month associations withstood additional correction for baseline stroke severity, p equals 0.035, whereas the 2-year associations were further attenuated, p equals 0.31. Conclusions. Changes in the levels of s-IGF-I are associated primarily with temporally near 3-month outcomes, while associations with long-term 2-year outcomes are weakened and attenuated by other factors. The significance of the change in post-stroke s-IGF-I is compatible with a positive role for IGF-I in his recovery. However, the exact mechanisms are unknown and probably reflects combinations of multiple peripheral and central actions. Add tags, currently, Springer, #everything by Sfakianakis G. Alexandros.